We continue to recognize Black Maternal Health Week. This morning, we're learning about the racial disparities and overall well-being of Black women throughout their pregnancy and postpartum care.
And joining us now is Dr. Dajai Scott, a midwife at Henry Ford Health. Good to have you here with us this morning.
Thank you. Thank you so much for having me. I'm excited to just be here and represent Black women and also Black providers during this Maternal Health Week.
It's our pleasure.
What do you think is the biggest overarching message that you would like to get across to folks who may not understand how preeclampsia, affects Black women especially?
Well, one of the things that I really want to highlight is just the fact that Black women are 3 to 4 times more likely to die during childbirth. And this is related to different pregnancy-related issues that they may have. But the first thing that women should do is just recognize when they have risk factors for things like preeclampsia. So it doesn't only focus on the patients themselves, but also providers being able to give women that whole care and recognizing, what different things may cause them to have risk factors. So, whether it's their first baby, being Black and having your first baby is one of the moderate risk factors that really increases the risk of women having preeclampsia. So I like to highlight that because there are little things that people can do to lower their risk of developing preeclampsia, including, taking low-dose aspirin, exercise, and really just knowing the resources that are out there and connecting with their providers.
All right, let's take it from a little larger level, a little bigger look on top. What is the role of a midwife or a doula when it comes to the pregnancy?
So midwives, myself, I'm a certified nurse midwife. I work within a hospital-based system, but we provide prenatal care to women. We also do postpartum and well woman exams. Doulas are those women that provide emotional support through women education, and they are there to advocate for their clients that they have. But also just recognizing that as midwives, we do a lot of education too, and we want to make sure that we support the women, their whole patient and family-centered experience that they have.
Do you think that most women, when it comes to prenatal care, where are they missing the mark in terms of, are they not getting the support? Is it not early enough on in the pregnancy?
So surprisingly, I feel like for Black women, the gap still exists when we talk about like access to care, education level, and income. But I do think that we can arm ourselves and really take the opportunities to seeking care earlier in the first trimester, finding providers that look like them or that hear them and see them. I think that really makes a difference because some of the things that happen to our Black women in the community are systemic racism and implicit bias related.
So, how do we get over that? What are the steps being taken? Are there steps being taken to get over this?
Yeah, well, so I believe that women deserve to be, transformed and not traumatized when they go into these birth experiences. So the first steps that I tell people is finding providers that see them. That can be a provider that looks like you or somebody that is just there to listen and understand, the whole you and give you that holistic care experience. Educating yourself early on, so that's finding childbirth education that's out there in the community, just to arm yourself with knowledge, because when you have knowledge about childbirth and pregnancy, you're able to ask the right questions. Midwives and doulas, there's studies that say that having midwives and doulas can improve outcomes. So finding yourself a midwife and hiring a doula, and now Michigan has started reimbursement for Medicaid providers or Medicaid patients, where they can get a doula that's provided to them free of charge. So I think that that's something that really makes a difference as well. And then just making sure that you care for your whole self, because a lot of times Black women have underlying health conditions. So when we make sure those things are in order, that can help to positively impact your maternal outcomes.
Yeah, a little bit of knowledge will go a long way.
For sure. So during Black Maternal Health Week, obviously we want to educate women all the time, right?
Yes.
But what would be a goal for this week in terms of what you would like folks to be able to walk away with that you think that is information they don't know?
Well, so I would like Black women to know that they deserve to be heard, they deserve to be safe in the health environments that they're in related to childbirth, but really just taking away that they are able to find things in the community. There are many community resources out there to help to educate them and prepare them for childbirth. I know Mother and Justice was just the story that was covered. There's Birth Detroit out there, knowing about, doulas, knowing that the hospital systems, Henry Ford, West Bloomfield, and Maine both offer doulas, to the patients that meet different social determinants or social economic statuses and things like that, to really just know that there are resources out there to help them, and making a plan postpartum to be prepared early on.
Yeah, great information. Find the resources. Thanks a lot for coming in, Dr. Scott. Really appreciate it.
Thank you so much.
Appreciate it.
Thank you.